Well, there was a claim that was put in December 2023 where we made very limited progress on. We were hoping for resolution across the summer in terms of when the estimates were submitted. That didn't result in a conclusion to the issues. The dispute then expanded to other issues, just in terms of pay, but conditions, about vacancies, about the allocation of overtime, about shifts that were actually more friendly from a work-life balance perspective, and also issues around health and safety. The difficulty was that we were making very limited progress on that until we called industrial action back on the 30th of October, which then precipitated negotiations with the employer, but unfortunately those have not been successful, which has led us to calling action tomorrow.
And I mean, you've been in negotiations. Why do you feel the GHA's proposals are insufficient?
So we've made progress. I mean, let's say that first and foremost. We have made progress on a number of the key areas. The sticking point is around the elements. Well, some of those are still in progress, and we still need to make progress on those until resolution. They've made a proposal in relation to the pay element, which falls short of the members' aspirations. We've gone back with a counter proposal, and we've invited the GHA to make an improved offer, which we've been advised, and again this was reiterated this morning when I approached the GHA regarding further talks. They reiterated that there's no movement, and therefore we've been left with no other option than to call the action.
Now, the action, of course, it's a sensitive area. It's the hospital, it's the GHA, medical services. People's lives could be impacted. Now, you do want to minimise disruption. What measures are you taking to minimise that?
So it's that difficult balance in that, because industrial action and strike action by its very nature is intended to be disruptive, to try and get a result that we're looking for and our members are looking for. Clearly, we are very sensitive to the clinical nature of the hospital, and indeed that actually forms part of the claim that we're actually making. So we're in the process of agreeing with the GHA cover in those critical areas to make sure that patient safety is not compromised, because obviously that is paramount for us, and it is not our intention in any way, shape or form to put anybody at risk.
What would you tell our viewers, many who could be patients at the hospital and could have their services or the care package interrupted or disrupted? What would you tell them?
Well, there will be disruption. That again is the nature of it. We apologise for that disruption. As we've said, the resolution to this is in the gift of the employer. They only need to come back to the table and make an offer that is acceptable and one that we can work with. But we do actually ask, our wider Unite membership and also the wider community to be patient with us, to understand what we're doing, to support what we're doing, and to understand that we will not compromise patient safety. But of course, there will be disruption.
Now, that strike action begins tomorrow. It'll run for a period of time. You set a time period when that action will take place. What are you hoping from the GHA within that window, and what are your next steps if they don't respond to the action?
So yeah, as you say, we're calling action from 8 o'clock tomorrow morning. That will run until just before 8 o'clock on Friday the 6th of December, when our members will then return to work normally from 8 a.m. on the 6th. We're hoping that the GHA will come back to us to invite us back around the negotiating table. Clearly, as I said, we are ready, willing and able to actually enter into those negotiations. If we take a week of action with no movement, clearly we will consult with our members in terms of what next steps are and how we escalate that action.